Leadership and advocacy in reproductive health. Advocacy for patients' rights and reproductive health policies. Leadership and advocacy in reproductive health play a critical role in advancing patient rights, ensuring equitable access to care, and shaping reproductive health policies that impact individuals and communities. Reproductive health advocacy focuses on promoting policies and practices that protect the rights of individuals to make informed decisions about their reproductive health. Advocacy in this area includes championing the accessibility of fertility treatments, supporting the rights of marginalized communities, and ensuring that reproductive health care services are available and affordable for all people, regardless of socioeconomic status, geographic location, or identity. This area of leadership is especially important given the complexities of reproductive health, the evolving nature of assisted reproductive technologies, ART, and the legal and ethical considerations surrounding issues such as infertility, contraception, abortion, surrogacy, and reproductive rights. 1. Advocacy for patients' rights in reproductive health. Advocacy for patients' rights in reproductive health ensures that individuals have the autonomy to make decisions about their reproductive health and that they are protected from discrimination and exploitation. A. Protecting autonomy and informed consent. Informed consent. One of the key aspects of patient rights advocacy is ensuring that patients have full access to information about their reproductive options, including ART, fertility preservation, and genetic testing. Leaders in reproductive health must advocate for clear, accessible, and comprehensive consent processes to ensure patients understand the risks, benefits, and alternatives of treatments. Patient autonomy. Advocacy efforts are necessary to ensure that individuals have the freedom to make their own reproductive health decisions without coercion or undue influence. This includes the right to pursue fertility treatments such as in vitro fertilization, IVF, as well as decisions around family planning and contraception. B. Ensuring access to fertility treatments. Expanding insurance coverage. A critical area of advocacy is ensuring that fertility treatments are covered by health insurance. Many patients are unable to access RT due to the high cost of treatments such as IVF, egg freezing, and sperm donation. Advocates work to change insurance policies to cover these essential services, making them more accessible to all patients. Affordability and access. Advocacy also focuses on making fertility treatments affordable, especially for underprivileged or marginalized communities. By reducing the financial barriers to ART, advocates can improve access to care for people who might otherwise be unable to afford such treatments. Geographic accessibility. Fertility services are often concentrated in urban areas, leaving individuals in rural or underserved regions with limited access to fertility care. Advocacy for broader distribution of reproductive health services, including mobile clinics and telemedicine, can ensure that people in remote areas receive the care they need. C. Ensuring non-discrimination in reproductive care. LGBTQ+ rights. Reproductive health advocacy must include supporting LGBTQ+ individuals and couples who often face discrimination in accessing fertility care. Advocating for inclusive healthcare policies that provide equal access to ART, surrogacy, and adoption services is critical to ensuring that all people have the right to build families. Reproductive rights for women and minorities. Advocacy efforts also focus on ensuring that women, especially women of color and those from marginalized communities, have access to reproductive health services without discrimination. This includes access to contraception, fertility treatments, and safe and legal abortion services. 2. Advocacy for reproductive health policies. Reproductive health policies shape how care is delivered, funded, and accessed. Advocacy for these policies involves pushing for laws and regulations that improve reproductive health outcomes, protect the patient rights, and promote health equity. A. Legalizing and expanding access to fertility treatments. Policy reform. Leaders in reproductive health must advocate for policies that expand access to fertility treatments, such as IVF and egg freezing. This includes pushing for the inclusion of ART in public health plans and ensuring that individuals who seek fertility treatments are not excluded based on their gender, sexual orientation, or marital status. Insurance mandates. Many states or countries have introduced mandates requiring insurance providers to cover certain fertility treatments. Advocacy at the local and national levels can help expand these mandates to ensure that ART services are available to a broader population. B. Supporting reproductive rights and family planning. Access to contraception. Ensuring that all individuals have access to contraception is a critical component of reproductive health advocacy. Advocates work to promote policies that provide affordable access to a wide range of contraceptive methods, ensuring that individuals can make informed choices about family planning. Abortion rights. Advocacy for reproductive rights often includes defending the right to access safe and legal abortion. This includes pushing back against restrictive abortion laws and advocating for policies that allow individuals to make autonomous decisions about their reproductive health without fear of legal repercussions. C. Legal protections for ART and surrogacy. Regulation of ART practices. As ART technologies advance, there is a growing need for regulatory frameworks to ensure that these treatments are safe, ethical, and accessible. Advocates work to develop and support regulations that govern ART practices, including the ethical use of genetic screening, embryo freezing, and surrogacy agreements. Surrogacy legislation. Advocacy for reproductive rights also includes advocating for the legal recognition and regulation of surrogacy arrangements. This ensures that both intended parents and surrogates are protected and that surrogacy is carried out ethically and transparently. D. Addressing global disparities in reproductive health. Global health initiatives. Advocacy is essential in improving reproductive health access globally. This includes working with international organizations, governments, and NGOs to address disparities in fertility care and family planning services, especially in low and middle income countries where ART and fertility care are often inaccessible. Cultural sensitivity and education. Advocates also promote culturally sensitive education and outreach programs to improve reproductive health literacy, especially in regions where there are cultural or social barriers to accessing reproductive health services. 3. Strategies for effective advocacy in reproductive health. Advocacy in reproductive health requires a comprehensive and strategic approach that involves raising awareness, engaging stakeholders, and using various platforms to influence policy change. A. Building coalitions and partnerships. Collaborating with other advocacy groups. Reproductive health leaders can build coalitions with other healthcare advocacy organizations, women's rights groups, LGBTQ+ rights organizations, and community-based groups to amplify their efforts. These partnerships can create a united front to advocate for comprehensive reproductive health policies that address the needs of diverse populations. Engaging healthcare providers and policymakers. Engaging healthcare professionals, policymakers, and legal experts in discussions about reproductive health policies can help ensure that advocacy efforts are aligned with the needs of patients and communities. B. Public awareness campaigns. Media engagement. Public awareness campaigns are vital to educate the public about reproductive health issues, the importance of accessible fertility care, and the need for policy reforms. Media engagement, including social media, print, and broadcast outlets, can help raise awareness and mobilize public support for reproductive health rights. Community outreach. Direct outreach to communities through education programs, workshops, and public events can help raise awareness about available reproductive health services, rights, and the importance of fertility care. C. Policy lobbying and legal advocacy. Lobbying for policy change. Effective advocacy includes working directly with lawmakers to introduce, support, and pass legislation that expands access to fertility treatments, supports reproductive rights, and addresses health disparities in reproductive care. Litigation. In some cases, legal action may be necessary to protect patients' rights and ensure access to fertility care. This may include challenging restrictive laws or advocating for the expansion of healthcare benefits for fertility treatments. 4. Conclusion. Advocacy for patients' rights and reproductive health policies is essential to improving access to fertility care and ensuring high-quality, equitable services for all individuals. Leaders in reproductive health play a vital role in advocating for policy changes that promote patient autonomy, protect reproductive rights, and ensure access to reproductive health services, including ART, through strategic advocacy, public education, and collaboration with key stakeholders. Reproductive health leaders can help shape a future where all individuals, regardless of their background, have the opportunity to access the care they need to build their families and make informed decisions about their reproductive health. By addressing disparities in care, advocating for comprehensive policies, and ensuring access to fertility treatments, we can create a more inclusive, equitable reproductive healthcare system that meets the needs of diverse populations globally.